Hi, I'd like to talk about anxiety today, specifically general anxiety disorder in general. I think that it's an important topic to talk about, and it's just being researched and defined every single day as something new. I know many professionals today are studying patients who actually suffer from anxiety, and they're trying to grasp a better idea of how deep anxiety can be for someone, for them to change, as well as gaining more insight on the biopsychosocial model relating to this illness. First off, I really would like to talk about how it's defined. I know that generalized anxiety disorder is excessive displaying of worrying for more than 6 months that affects somebody's personal health, social interactions at work, and in everyday life functions. I know many researchers have found that environmental and genetic factors play a big role towards like shyness and stress, and even like health problems such as like having thyroid problems is a big genetic factor as well. I know that many psychologists and professionals would lean towards psychotherapy, so cognitive behavioral therapy and medication to help people with anxiety, to help them through their everyday lives. I know that if we look globally, Australia, about 14% of their population, so that's about 1 in 7 people, have experienced a anxiety condition, and that's about maybe 3% of their population that has been diagnosed with generalized anxiety disorders. Children who experience generalized anxiety will absolutely perform poorly in school and even sporting events. They are over-conforming, perfectionist, unsure of themselves, and always trying to seek approval. Both genders are affected, both men and women, however, women more so than men, and it can happen at any age. I know that statistically they've shown that somebody with anxiety will develop it in their 30s. So as we continue talking, I know we will talk about the biopsychosocial. So biologically, the aspect of that is that their endocrine system and their nervous system play together. And if anything is out of balance, such as certain neurotransmitters as adrenaline or noradrenaline or GABA or serotonin are unbalanced, it's going to cause somebody to have a greater scale of anxiety versus somebody else. Psychologically, researchers have found important psychological variables, all dealing with cognitive abilities, and that would be perceived control, cognitive appraisals, cognitive beliefs, and cognitive distortions. Those are all pretty much based on past experiences. So it's also important that we try and change cognitive behaviors. Socially, the environment will affect somebody and towards their situation. The social learning theory developed by Albert Bandura was also important in how we observe others in a situation. So pretty much to sum it all up, I mean, we can see that in general anxiety is a very big topic and that it's not studied enough, and we would really like people around the world to figure out how to better fix and help people change, people who have anxiety, whoever is struggling, because it's not an easy disorder to deal with. I mean, we can see through the biopsychosocial model that it's a big role.